No, we were cooking the cast, right? Still there now?
Yep, and I see recording.
Yay.
Well done.
Yeah. Second time's a charm, is that what we're gonna say? All right, well, welcome to our second night. It's great to see everybody. Those who were with us yesterday, welcome back. And those who are just joining us for the first time, we're glad to have you. Our goal here is just to give you as much information about Purdue, College of Veterinary Medicine, the life of our students, a little bit about our curriculum, and just what to expect as an overall PDM student. Just like last night, Dr. Salisbury is going to talk a little bit about third year curriculum and some other things. And I believe we have some videos that we might show as well as of the new hospital. But just like last night, and for those who are new, if you have questions, just start putting them in the chat. And after our students kind of finish introducing themselves and giving you a little bit of background about themselves and whatever, we'll go to the questions. So you can put those questions in the chat at any time, and we'll go back to that and look. And of course, during that question and answer session, if you want to pop on your mic, fine by me. It's okay for you to come up and introduce yourself and ask a question as well. All right.
We like to hear your voice.
Huh?
We like to hear their voices.
Yeah, we do. We really do. Because I don't know about Dr. Salisbury, but I get tired of hearing myself talk. All right. So without further ado, though, we're going to have Dr. Salisbury kind of go over the third year. Okay.
Yeah. And first, I want to show you. So, like yesterday, there were some questions about the new hospital. And so we got some videos and video renditions of the new hospital to show you, and we won't go necessarily over all of these. But Lori, why don't you click on the second link first, the red second link. And these are some renditions from the architects of what the new hospital is going to look like. And so the timeline, is it going to open? No, it won't work right when you want it to work. Is it working? You're muted.
And I have to share that. I thought there was a way to
So these are renditions from the architect. Yeah, and then if you can make it full screen.
That is not full screen, is it?
There, yeah, there you go.
Sorry.
So this shows driving along the road, next to what the new complex will be. All the buildings on the left there are going to be new buildings. The one straight ahead is our current hospital's on the other side of that. And so we're going to turn in when we come up to the hospital. This is the back of the small animal hospital that you're seeing here, the new addition to the small animal hospital. So this is all under construction right now. And it's going to be open in a little over a year from now. And so right now it's to the stage where there is a roof being put on it, and the window openings are in and all that. So what you're seeing there, that's the addition to the small animal hospital. So for the small animal hospital, we're doing a big addition. The current hospital will also be in use. And then the equine and the farm animal hospitals are going to be completely new. And so they're actually behind the small animal hospital. The equine hospital is connected to the same building. And then the farm animal hospital is like down the hill to the left of what you're seeing now. So this would be client parking, which is right out in front of our current library, the library in the Lynn Hall, which is where the vet school is right now. And so clients will park here. And right now this is all a big construction site, but the shell of this building is in place. And then there is a connector that connects this building to our current building, which is what you see on the right-hand side over on the corner there. That's the connector that connects the two buildings so that people and animals can go back and forth between the two buildings. And right now, this shows how there's like a memory garden for that some of our clients have established that have plaques and stuff on the other side of that hedge that are tributes to their pets who have passed away. It's a tribute garden, pet tribute garden. So that's going to be all the way along the front of the hospital here. And there's like an archway on the right there that'll go into the tribute garden. And straight ahead is the entrance to the small animal hospital and the reception area. And we're going to walk in, and then we have another video that'll walk you down the hall of what it's going to look like. But this is going to greatly increase the space that we have. So Lori, if you can go to, I think it's the next one after this one. Whatever said the inside of the small animal hospital. Percy wants to see it. He's watching. Yeah, so that's the entrance. And this will go into the reception area for small animal where everybody will check in. And then some people will go to the old wing, and the many services will be in this new wing. And so we have completely new spaces for all of small animal surgery, neurology, ophthalmology, internal medicine, hemodialysis, interventional radiology, anesthesia is all new. That's all in this new hospital. So this is this hallway on the right is all exam rooms. And on the left is windows and seating area for clients. And so right now we only have like 8 exam rooms, and this is, I think we're going to have something like 18 or something in the new hospital. So it's a big expansion of our exam rooms. Plus we'll have the old hospital still too. So it'll be nice and bright, and lots of natural light, which will be really great. There's computer stations for clients to be able to sit with their computers and work. And then it's going to take you into an exam room, and you'll see the exam rooms. They'll be bigger than what we have now, which is really good because they're quite small. And then if you want to show, how many of you are interested in large animals? Do you want to see equine and farm animal or not? I don't want to bore you with all these videos. Why don't you do the drone flyover? Do that, the very first one, Lori.
First one.
Yes, you want to see it. Okay.
We did have some ham raised for the farm animal though, so we'll go to the drone.
Do the drone so they can see what the site looks like. Okay, looks like we got votes for seeing farm animal and equine. We've also got one of the emergency area in small animal. So here's what this construction site looked like. Now it's further on now. Now we've got like a roof going up over the buildings. So this is the back, and you're seeing equine from the back here. And they're going to have finger barns coming out from this area. There'll be a surgery barn, a medicine barn, and ICU is in the middle. So this is all equine, the back of equine. And then so equine's on the like ground floor there, and then up above is small animal surgery. And small animals kind of stacked on top of equine. And let's see, this is the small animal hospital before the window areas got put in and the external cladding is on now. And there's a roof on top of this now. There's actually cameras that are doing live filming of the construction. So this end is the emergency hospital. There's a separate entrance that we can show you, and small animal emergencies down here. And then equine is in the back there. And there's lots of busy construction. They're on track. They are set to finish in March of they're set to finish in December of this year. That's when construction should be done, December of this year. And then this is farm animal. So this is the farm animal hospital, and it's actually all enclosed now. So they've made more progress from this drone flyover that they had. So it's set to be finished in December of 2021. And then we're planning on moving in. It's targeted at March 2022. that will be moving into the new hospital. And then we'll have to do some renovations in the old hospital to expand spaces there. You could go on to the small animal emergency, Lori.
Small, which one?
Small animal, and we'll just do whatever ones you haven't done, because then we can, they want to see all of them, I think, right? You guys want to see all of them?
I know I do. I'm like enthralled.
It is pretty exciting. It's going to greatly expand our area and our functionality. So this is emergency, yeah.
Oh, yeah, I hit emergency first.
So this is a separate entrance for emergency at night. And then we'll be able to, they'll use some of the exam rooms on that hallway, but we'll be able to lock off the hallway so that the clients who are here after hours won't have access to the whole area of the exam rooms or the other reception area. So that's where they'll check in, and these are the exam rooms. And then you can see the doors down there. We'll be able to lock those so that people won't be able to get into all of the exam rooms. And then there's doors down at the other end as well. But that's pretty much the gurneys in the hallway so that can easily get animals on gurneys. And then there's separate exam rooms for ER, and then there's also treatment rooms and the emergency ICU areas right by here too. We're going to have an ICU and an intermediate care ward. Intermediate care ward is for animals that don't need critical care, but they need IV fluids and stuff. So they're like a step down ward, as they're also called. So that'll be a whole separate room from ICU, which will be really nice.
This is a large animal.
Okay. So now we're going down the road the other way, and the entrance to large animal is going to be down at this, what is it, southern, eastern, and southern end. And there's a fence all the way around the whole complex, which will be really good so that it will be less easy for animals to escape into the campus. So now you're into the large animal hospital area. This is farm animal down here that we're going by. And then there's some paddocks for horses and an arena where they can exercise horses, the open arena there. And then this is equine. So the reception area is that glassed area where the clients will check in. And then there's an outpatient area that has treatment rooms. And then that's the outpatient area is kind of separate from the regular hospital, from where the hospitalized patients are.
Now we'll do the farm animal.
Not sure what the noise is.
Try my laptop. Oh,
okay.
So.
So that's a farm animal hospital. Now this time the gate will open when we try to go through it. They forgot to open it the first time. And so the farm animal hospitals, so they can pull trailers in right into the garage door area and drive straight through, unload the cattle and then, or pigs or whatever they are. And then there's a chute system to be able to handle cows that are not used to being handled. And then they can drive out. And then the clients, Percy, get out of the way. The clients check in for farm animal over here. So it's completely separate from equine so that we won't have any mixing of horses and farm animals for biosecurity purposes, and so that equine clients don't need to see food animals, farm animals. What are you talking about? And that's, you can see some of the, looking into the where the all of the handling areas for the cattle are. And then we've got really nice, though we will have really nice stalls for being able to squeeze cows against the side of the stall and be able to handle them much safer. And the chute system. There's the chute system. With really nice cows in it. But we're really looking forward to having the new hospital. Anybody have questions about it? No? Okay.
I actually have a question.
Yeah, go ahead.
My name's Callie Knott. I was just wondering, as far as the old teaching hospital, will there be any, will that just be for teaching purposes, like the vet school now, or will they incorporate some in the new school?
Yeah, the large animal hospital will be demolished for the most part. It's really outdated, old space. And so we'll be using some of it as like transition space where we have to temporarily move some services when renovations are happening in current Lynn Hall. But once that happens, it's going to be torn down. And so that's so the current large animal hospital accommodates both horses and food animals or farm animals. And then the small animal hospital, that's all staying, and we're going to have to renovate that. And because there's several services that are going to be staying in the old building. The small animal community practice, behavior, dermatology, cardiology, oncology, radiation oncology, they're all staying in the old building. So there's several services that we have to renovate space for so that they can expand their footprint. But it's going to give us lots of space. We also, I didn't mention in the new hospital, I said neurology, physical therapy is going to be in the new hospital, and physical therapy is going to have a swimming pool as well as underwater treadmill and lots of PT space. So that'll be really, really good.
Thank you.
Yep. Other questions? Well, we just wanted to show you what's to come. It won't be too long before we're in it. So Laura, you can go on the next slide. So we're going to talk about third year, and to give you, I mean, many of you were here last night, so I'm not going to spend a lot of time on this, but you know the DVM program is 4 years. First 2 years are basic sciences, so that's things like anatomy, physiology, pharmacology, pathology, virology, bacteriology, all that type of stuff. And then the years 3 and 4 are clinical sciences, and year 4 is all in the hospital. And so we're going to talk about that one of the days next week. But year 3 is a really, really good year. I'm not biased. I'm a small animal surgeon by training. And so I'm Associate Dean for Academic Affairs and chair of the admissions committee, but I'm also a small animal surgeon. And I used to be in the clinics. I haven't been in the clinics in about 2 years now, but small animal surgery is great, and you get to do it in third year. So that's what makes, and large animal surgery too, not to leave Brooke out, but the surgery laboratories are really great because you're learning to be a surgeon and you're practicing and you get good hands-on experience. So you can go to the next slide, Lori. And so I'm just going to show you the list of courses that occur in semesters 5 and 6. And so this is where you learn diagnosis and treatment of diseases of all the various species. So small animal medicine and surgery, equine medicine, food animal medicine, and then there's a small animal surgery laboratory, principles of anesthesia, theriogenology, that's reproduction. So that's reproduction across all the different species. And then veterinary skills and competencies, which we talked about a little bit yesterday for those of you who were here yesterday, but that's where you learn technical skills, physical exams, sample collection, communication skills, financial skills, some wellness. It's all the practical things that you're going to use in your practice career. And then current issues in veterinary medicine is a seminar course that doesn't meet every week. But the big thing is it's 20 credits. It's a lot of courses, a lot of material, and a lot of time. And as the surgery laboratories, which the third years can tell you more about, are fairly time intensive as well. And so that takes up a lot of time. This is a new curriculum. This is the first year we've implemented this third year curriculum. We expanded what we call what's the core, and that's what everybody takes. So this semester is pretty much all core, and you can go to the next slide. And semester 6 is about 3/4 core. And so it's the rest of small animal medicine, large animal surgery this time instead of small animal. There's a small animal primary care and wellness course, which includes dermatology, emergency critical care, the basics of it. Let's see, primary care, which is like vaccinations and geriatrics and pediatrics. So all those wellness type things. And dentistry as well is in that course. And then ophthalmology, a core ophthalmology that covers all species. There's achieving success in private practice is a business-oriented course. It's about getting your first job and how to be a successful associate in a practice. And Dr. Wiseman, who's the Assistant Dean for Student Affairs, teaches that. And he counsels a lot of students on the business side of things and reviews lots of contracts. Then there's a continuation of the surgery laboratory course. There's a diagnostic imaging course, that's radiology, where they also do things like ultrasound, CAT scans, those types of things. And then continuation of the VSAC courses and current issues. And then there's 5 credits of electives that everybody has to take in this semester. And that can be based on the area that you're going to track in. And so we have 7 tracks. I'll go through those really quickly for those who weren't here last night. The most focused tracks are small animal, equine, and food animal. And so food animal and equine are only in the large animal hospital in their 4th year, small animals only in the small animal hospital. Then there's the large animal track. They're only in the large animal hospital, and that's equine and farm animal or food animal. And then the mixed track, they're in both hospitals and they do a little bit of everything. The companion animal track is horses and small animals. So that again is in both hospitals and they do a little bit of everything. And when we say farm animal or food animal, the majority of the patients that come in the hospital are actually horses. So people in the food animal track will do a lot of horses because that's the main inpatient caseload, although there's quite a few food animals as well. But equine definitely outweighs them by a lot because we see a lot of horses. But so you get experience in all the large animal species, but you can focus particularly your electives in the 4th year and in this semester 6 on the species that you're more interested in practicing on when you get done. So that's about all I'm going to say about the courses, because now we want to have the students introduce themselves. Lori, you want to introduce the students or have them introduce themselves?
Yeah, so tonight we have 3 of our students with us, and we have Leah Douglas here, and Cameron Seeger, and Brooke Harvey. And I will let them tell you a little bit more about themselves. I will go alphabetically. So Leah, I will let you go first, and you can just tell them, why you chose Purdue maybe, and how your 3rd year is going, and whatever other advice you would like to give them.
Hi, I'm actually from Houston, Texas, so a little bit far from home. I originally chose Purdue because I first came to Purdue during my 2nd year in undergrad. There was a pre-veterinary conference that Purdue was hosting. I know different vet schools host them different years. So that was kind of my first exposure to Purdue, and I really liked it there, especially getting to see the faculty. And then I heard more about Purdue when my friend did a summer internship at Purdue. And then I decided, okay, well, I really like this school. I've heard good things about it. So then I decided to do the summer internship as well, because I was still on the fence between Purdue and my in-state school. And so then after I did the internship, fell in love with all of the staff that was there, and I really liked the faculty as well. So then I kind of solidified it, and there were a lot of other things that my in-state school would require that I was going to have to take a lot of extra classes, and Purdue kind of worked with me more as far as fitting my classes and everything, and was just more open with me. So then I chose Purdue. And then I guess as far as third year is a lot busier. It feels like a little bit more material, but whenever you kind of break it down, you're actually learning just a bunch of diseases with the different parts to it. So it feels like a lot more material, but it's not. I definitely like it because I feel like first year you kind of get things where you're like, okay, I know that something's not right. And then, or I know that this isn't normal because this is not what we've learned. And then second year, you're kind of like, okay, well, I know that this isn't doing right and I know how it got there. So I think the summer before third year, I was kind of in that waiting stage of like, okay, I have this missing puzzle piece because I've learned everything that should be going on and I know how it got wrong, but I don't know how to treat it. So I think third year kind of helped put it together because we got more information on treatment and how to put things together, and also diagnosis, how to make your diagnosis. And then as far as the things that I saw in my peers, I feel like with my peers, there is definitely more adaptability. I think we don't realize how adaptable we are, especially because we've kind of had pre-COVID about a year and a half of being adaptable because, you know, once you get into vet school and, you know, the classes they definitely have more material, you go through things faster, and you kind of have to adapt to what learning technique or studying technique you have. And so when COVID came, I noticed that it was, as much as we thought it was going to be a challenge to change, we still were able to do it because we had been adaptable, you know, the whole time. Also, because you're doing junior surgeries and we've never done surgery before, or at least some of them haven't done like major abdominal surgery, there was definitely a lot of teamwork that happened. And to kind of go along with that with trust, because I think there are times where you're like about to cut it open, or maybe you go blank. You always have that person who's there, who's your assistant, that's like, okay, calm down. Okay, or, you know, even when you have surgeons there as well that will help you, but definitely having that teamwork because, you know, with COVID and everything and trying to figure out everything, we've had to work together to make sure we got everything we needed to, and that if there was any missing information, that it was covered. Even with, you know, us having a new curriculum and some of the new courses, there are some holes that we were able to kind of fill because we worked together and worked with the professors and stuff. So definitely, I really liked third year, especially because of the surgery and having that hands-on experience. It's not all in the classroom like first and second year was. You did get clinical experience from VSAC, but it's nothing like being able to do surgery. It did add a lot of time, especially with like the longer procedures. So when she does say like, you know, you have your other courses and then that surgery time adds on there, maybe not as much last semester, but now that we're doing like all surgeries, it definitely adds like one day out of the week where you're like, okay, that night I probably won't be doing anything but doing patient care after the surgery. But it's still exciting because you haven't really done it before. So yes, my tidbit.
Thanks, Leah. From what I gather, you really like surgery.
Leah, what are you tracking? You should tell them so we can.
Oh, I'm tracking small animal. I am again from Houston, so I never really was around large animals. Although I did, Dr. Townsend, who's no longer here, he kind of convinced me to do cows and cattle, but yeah, just not that strong. So definitely tracking small animals.
Thank you, Leah. All right, Brooke, why don't you tell them a little bit about yourself?
Hi, everyone. So my name is Brooke. I am from the central Indiana area. So Purdue is my in-state. Little bit about me, and I really enjoy working with food animals, but all large animal really as well. But I decided to track mixed animal. So I'm taking both large and small animal surgery this semester. So like Leah said, pretty busy, but I also agree that it has been a really great experience. I personally learned the best from all the hands-on. So third year, like Leah said, has been one of my favorite years. Even if it is pretty busy, it still makes you feel, for the first time for me, it made me feel like a doctor, you know? So I have to say that that is probably my favorite part so far about third year, is just kind of diving right in to surgery, and even all the classes. Even when you are in the classroom, you're starting to make the diagnosis and what you would do to treat. I just, like I mentioned, it really makes you feel like a doctor for the first time. And like Leah said, putting all the puzzle pieces together. So going off of how Leah talked about COVID, our class has really become united. And that was something that was really cool to see throughout all of the craziness. Let's just say that, that our classes really work together more than ever. So I think that was pretty neat. And I will never forget, I heard a couple years ago, I think it was at our interview banquet that we got to have, one of the speakers said, "I don't have 84 classmates, I have 84 best friends." And I thought that really applies to this year, because we've all kind of held each other accountable for our work, and we've held each other accountable for our mental health as well throughout the pandemic. So our classes, not just our class, all of the classes seem to be really close at Purdue, which that is a huge thing. That was one of the big things for me why I chose Purdue, because yeah, they say, I've heard from a lot of people, Purdue's a big family, but when you see on the interview day, they truly are a family, and they're not kidding when they say that. So I guess that was my biggest reason why I chose Purdue. I don't know really what else to say other than, because I feel like Leah covered a really good bit of it.
I think you'll probably have a great opportunity to ask questions some of it though, so thanks, Brooke, appreciate it. All
I
right.
would like to kind of recreate the interview day, which you guys aren't able to do, and to come on campus. So Brooke, I really appreciate you sharing that that's what you thought about interview day when you were able to have it.
Yeah, definitely. All right, Cameron.
Okay, my name's Cameron. I'm from Southern Indiana, and I am tracking small animal. I'm specifically interested in surgery, so I am also taking large animal and small animal surgery. So you stay busy, but definitely fun. I would say Purdue is my in-state school, so that was very nice. That's very affordable, especially, I mean, the amount of education that you're getting, you're going to pay for it. So it's very nice that comparatively, Purdue is very cost effective when it comes to veterinary education. And so as someone who is cautious about that, as everyone I'm sure is, paying back your loans afterwards, it's reassuring that you know you're going into a career where you're going to have an opportunity to get a job, and that you're also minimizing as much loan as you can. So I would say small class size was another thing that was very important to me with Purdue. I know I have friends that went to other larger schools, and they don't know or aren't nearly as close with their classmates as I am. I feel like for labs or projects or whatever, whoever they throw me with, I know I'm going to be able to work with. And that's something that I'm sure not everyone feels in certain situations. So to be in such a demanding education as veterinary medicine, and to have trust in your classmates, that definitely is the backbone, because the 4 years are definitely long, but I mean, like Leah and Brooke said, the friends that you make are definitely helping you push through. As far as third year, my favorite thing is that I can finally sit down with a clinician or something and have a doctor conversation with them and genuinely understand what I'm saying and what they're saying. So that definitely feels like an accomplishment. And so little things like that, that as you go through the curriculum, you see yourself grow as the doctor that you're going to become. Take advantage of those. And when you realize them, give yourself a pat on the back because it's hard to get there. So it's great to see things come back and them pay off.
Cameron, touching on it, you mentioned the finances, and one of the things we talked about yesterday was that Dr. Wiseman, he does a lot of financial awareness with you guys, but we also have that financial advisor who comes in. Brooke and Leah both, can you guys talk about maybe, because the first year students probably haven't got to experience the help that she's going to be. So can you guys maybe talk about what that means to have someone who you can talk about, how you're going to afford vet school plus, on into after graduation and paying off loans or whatever you need to do?
Yeah, for sure. And I feel like it's never too early to be financially cautious, especially when you're going through vet school. Your income is the state that you're going to pay back. So you need to be cautious of it. And so talking with Dr. Wiseman, I mean, as third years, we take a class. This week, I think we're actually doing budgeting. Like that's what we do on Thursday. We're going over budgeting. So being cautious of that and being trained in that, I think is very valuable. And then Lori talked about Renee, who is our AVMA financial advisor. And so she is a financial advisor that specializes in knowing how to help people like us that are veterinary students or veterinary professionals that need help with loan repayment and planning things out. So I actually met with her at the end of last semester and just kind of gave her what my plan was. I personally am interested in doing an internship after veterinary school, so she can help me plan on how I'm going to be repaying loans for that year, and then potentially a residency, or if you go into practice, what your salary will be. And she's, I would say, very, very valuable. And if you don't want to take advantage of that, that's fine. But I think that it is great to have that resource there, because I'm going to school to be a veterinary doctor. I don't want to have to stress about my money on top of that too. So being able to have her take a little weight off my shoulders, I will take that any day.
Thanks. Brooke, are you anything to add?
Her too, this past semester. I think that, like he said, like she's very valuable. I'm the type of people, I'm not very like financially savvy. And I think Purdue definitely like constantly from like day one always had us being very mindful of that. And I'm the type of person where I was like, I don't really want to see how much money I have to owe. I don't want to worry about that. But as much as they put it on you, I'm just like, okay, fine, I'll actually look at it. And then, when I finally met with her, I kind of showed her like, okay, this is what I know what I'm doing. This is what I think I need to do. And she kind of helped me kind of get a plan of what I need to do over the break. This is what you kind of need to set up. This is what you're looking for. But she also kind of gave you an idea of like, okay, whenever you get out as a veterinarian, it's always good to have, someone, a financial advisor, even then, depending on, what your plans are, for your future, if you want to have your own practice or what you want to do. So I think she kind of set me up now so that I can be in a better position when I get out, and then also have, someone when I get out that can help me wherever I end up. So I think she gives very valuable advice. And I think Purdue does a really good job of constantly making us aware of those things, because you try to avoid them, but it's not something you want to avoid, and it's something that you kind of want to hit head on, so you don't have to deal with the repercussions later.
And to chime in with her saying that finding someone after you leave Purdue, Dr. Wiseman and Renee have both always been super open with us and say, after you graduate, you can still contact us. So it's taking something like that it's not just because they're here at Purdue, they're here to help you. It's deeper than that. They truly want you to succeed and build yourself up.
And to go off of those things, like Dr. Salisbury mentioned earlier, in the VSAT course, we also have different discussions on financial awareness. So I know Renee has come to speak to our class a couple different times. Dr. Wiseman helps us build a budget in first year VSAC. So you get started pretty quick out the gate with those kind of things, which I think is really beneficial, and it helps us to automatically be financially aware. So
We do have a question in the chat, and it says, is there also training on business development and small business and practice budgeting and finance?
I know I did not get involved with it just because of my plan afterwards. I don't plan to own, but a lot of, I don't know if a lot of, but a good chunk of our classmates Purdue offered some periodic business running courses that they could take. And then also there's a Masters of Business Administration or something like that, MBA, that you can also take concurrently that I don't know if anyone in our class did, but I know that you can do. So there are options.
So there's actually a club. I don't know if anybody's talked to you about our clubs yet or not, but Veterinary Business Management Association, I believe is what that stands for. It's called VBMA. And so they have a lot of speakers come in. Before the pandemic, we'd have lunch meetings and things like that, but we're still having Zoom calls with different people who speak to us about finances. And it's not just owning a veterinary business. It's talking about just financial awareness in general with many different things. It talks about credit scores and just a bunch of different business finance related aspects. So definitely if you're interested in that, VBMA would be a really important club for you because it's been helpful for me. I sadly didn't join that club my first year, but the second and third year I joined. So it's helped me a lot already. And they have a conference in the fall that you can go to. It's just a weekend where they have multiple different speakers talking about everything that from, like I said, from business to finance. Renee came to talk about credit scores and how you can improve that, and buying a practice, owning a practice, just all aspects of that. So definitely that conference would be really big for you as well if you're interested in that. But VBMA is a great club to look into.
And we have an elective business course that's Dr. Wiseman's course is core that everybody has to take. And then we have a separate half credit course that's offered at the end of this spring semester for the third year class that's taught by an MBA, and he owns many practices in the Chicago and Northern Indiana area. And so he comes down and leads discussions on what does it take to, own your own practice, and how do you market yourself, and he does some financial talk, going over ledgers and gains and losses and profitability and that type of thing too. So that if you're interested in more owning a practice and managing a business, his course is a good elective for that. And then there's also a course that is offered to practice managers, veterinarians in practice, veterinary technicians that might be managing practices. And it's a veterinary, what's it called? It's a management course that goes over 2 years. And I think it's 4 different sessions that are like a Thursday evening, Friday, Saturday. And it's put on by the Krannert School of Business on campus. And our students can apply for a scholarship to take that at a very, very reduced rate. And we've had several students do that over the years as well. And it's training that most people get once they're out in practice, but you can get a great deal on it as a veterinary student. And then if you get the scholarship, that really covers most of it, or a lot of it anyways.
Good question. Then we can open it up for anyone else. You can pipe in, just unmute yourself and ask questions, or you can type it in and I'll.
I had one question about the current issues in veterinary medicine. What are some of the topics that you guys are discussing now?
So as far as last semester, we're still working on the schedule for this semester just because of the current situation that we're in.
Yeah, COVID's made it challenging.
But a lot of other topics that we've discussed, I'm trying to think, we've gone over a lot of things. I mean, we've talked about conservation medicine to ethnical diversity and acceptance, and we've talked about, I'm trying to think, it's COVID, a wide
last
range.
semester we did COVID and epidemiology and looking at the literature on COVID infections. Led a discussion led by a couple of our epidemiologists. But it's a course that is designed to supplement the curriculum. And so we do different things every semester. We try to have something on diversity every semester. And we sometimes will have different career paths. We've had panel discussions on if you want to do an internship or residency, have the interns and residents, some of them come and talk to the students. Sometimes it's current events like these are like COVID right now. Bird flu, we did that when that was a current event. It's a whole variety of different topics. And it varies. We also do research. Normally in the spring semester, there's a research day. It's called PVM Research Day. And it's a whole day devoted to showcasing all the research in our college. And normally that in this semester, that course is used to, we rearrange things and shuffle things around. And so that's a required part of this course in that all day research day, the students go to the research presentations to get examples or a sampling of all the different kinds of research happening in our college. We're not doing that this semester because of COVID, and there's reading days that one of which we actually picked to put research day on a reading day so that it didn't mess up classes. So reading days won't have any classes, and so it's optional for students to go to this year. Normally that would be part of the current issues course.
And if anyone is interested or has a desire for research or doesn't know about research and wants to try it out, Purdue offers, or the vet school offers, an awesome summer research program that you can apply for and you get paid for, which is very nice. But the opportunity that you have there, I mean, they pair you with a mentor who's doing research in the college already, and you kind of get a little taste of what research is like within that realm. I did it last summer, and I had not been involved with research ever before. So it's a good opening door to whether you do like it, you don't like it, or you just want to get your name on something that could be published. It's really fun to be a part of.
Thanks, Kevin. So we do have a question, Dr. Sauer, you may be able to field this one. How possible is it that you can take electives on top of required classes when they aren't scheduled in? And if so, how many credits, classes can you add?
So I'll tell the kind of the rules, and that's that usually we can encourage people not to take more than 21 credits. Now, since there's 20 credits required, that doesn't leave a lot of options for electives. And could you take 22? Maybe. If you came and talked to me about why you wanted to do it, you were performing well, we might let you take 22 credits, but usually 21 is the limit. And so I'll let it leave up to the students to say whether you think you can add electives or not.
A lot of the electives that are offered are like 1 credit or a half credit. So usually if you do want to take one more elective, you can put it on there. Like I had 20 credit hours and then I added a half credit course for international veterinary medicine. And there are electives like that that aren't very demanding that I think, yes, for sure, put it on top of the 20 that you have just because it's good experience. It's good to be involved with that. But I do think that what like Dr. Salisbury was saying, you don't want to push yourself too much because those core classes that you do need to take are the basis of your medicine that you're going to be practicing. So don't take something at the expense of those.
That's good advice, Kim.
Also, the electives that they had, like for previous, not as far as in third year, you could take them if you had like special interest in that. Like a lot of them were a little bit more specific in a certain topic. So I know my friend, she liked exotics, so she did a class that was similar to that where she got to learn a bunch of other species. So you can take them, and a lot of times it also makes you think like, do I really have an interest in this? And you can kind of take that time to figure those things out also before your third year. But also if you really like that, you can also figure it out then. So it depends on you, but you don't want to overload yourself too much. I think after your first semester, you might be able to see a little bit of how busy it can be, and you can kind of judge based on that if you are able or you want to take those electives.
Yeah, and we don't let first semester students take electives so you can get your feet on the ground. So they start being available second semester, but there's some things like a shelter medicine course that's 1 credit. It's not super stressful. There's another course that's on forensic veterinary medicine, and that's only offered every other year, but that's an interesting course as well that I don't think students find those too stressful to add on to their schedule. Brooke, did you take the large animal anatomy courses?
I'm taking the large animal anatomy course this semester. I didn't take last semester, but I'm taking this one this semester.
So these are applied anatomy courses that are like you learn about how the anatomy applies to doing joint taps or nerve blocks or palpation.
And Desiree wants to know, how did you decide on which electives to choose the 6th semester?
I chose based off of my end career goal. So I know some people are like, I don't really know what I want to do. I'm tracking mixed. I want to just kind of see what's going on. And I think in that case, you can email the professor of record for that class and kind of ask what would be going on in that class. And they'll kind of tell you the gist of it. And that way, you know, oh, this is something that I think would spark my interest versus something that I'm like, well, I don't think I want to put myself through that. But I think a lot of us, by the time you get to 3rd year, you've had a pretty good range of like dipping your toes in different areas that you have enough knowledge of what you want to do to choose your electives.
Also, I had to talk to my advisor because I find interest in a lot of things. And so he kind of had to like talk me through things, like there were a bunch of electives to choose from. I'm not very decisive. So I kind of like was like, well, I'm interested in this one. And he kind of asked me a little bit more questions about, okay, well, what do you think about this? Or how would you feel about doing this in the future? Because I wanted to kind of put it towards what I wanted to do, similar to Cameron, what I wanted to do in the future. So after kind of, you know, him going through questions as far as like, well, I don't know, it kind of seems like you're really not that interested in that one. And maybe you're wanting it for other reasons, not necessarily for now. So also working through it with your advisor will definitely help, especially someone that has known you a little bit more than some of the professors you don't see as often. They can kind of really help narrow you down into, okay, well, maybe you don't like that as much, or maybe you really like that and you just need to explore it more. So.
And they pair you kind of get preferences on what clinician or professor you want as an advisor, and they try to match you based off of those preferences. So that way you have someone that kind of knows what you're wanting to go into, or someone who you click really well with that you're like, hey, like Leah was saying, can you help me decide something? So it's nice to have an advisor that understands the process that you're going through. So I think that's definitely, I don't know how other schools do it, but I definitely think Purdue matching you with someone that you've kind of preferenced is very nice. I have very much liked that, and it's gotten like a nice relationship and connection point there.
Going off of that, for me specifically, I've been interested in large animal surgery. So I thought to myself that I wanted to just do a large animal track and just take all large animal classes. But I was paired with Dr. Stephen Adams as my advisor, and it was nice to just be able to sit down and talk to him and just go back and forth with ideas. And so definitely my advisor helped me with deciding which courses to take for my 6th semester, but also with tracking, he helped me decide that as well, based on what you've decided you're interested in throughout the first 4 semesters of vet school, kind of like Cameron and Leah said. So I agree there that having your advisor as someone that you choose is really beneficial.
There's a question about behavior electives, and there is an elective in behavior and small animal behavior. So there's a required course in behavior that everybody takes that's pretty much normal behavior. And then there's a small animal behavioral therapy elective in semester 6 that students can take. And there's also a rotation in the 4th year that is behavior and dermatology combined. We have one behaviorist and we have one dermatologist. And so they share a rotation where you do both in that rotation.
All right, and Desiree, you kind of made do my job for me, and I really appreciate that because you gave them that link. So look at you, girl. I'm going to give
I
you
saw a
this.
question about if your plans have changed since you've been in vet school, as far as what you want to do in the future. I think two people or maybe one person said it. Mine definitely did. I came in thinking I wanted to do cardio, and I took cardio the first semester and was like, I do not want to do cardio. So I think definitely vet school is one of the things where it's like, once you get in that class where that's all you're talking about, and you get a little bit more of like, what are the things you're going to be seeing and how those things are treated and how you have to diagnose it. You definitely are, and especially first year, whenever you're like learning just the gist of physiology more in depth than you would in any undergrad course, you definitely get an idea of like, this is not what I want to do. This is not what I want to see every day for the rest of my life. So your plans will change depending on maybe if you were at a specialty clinic and that's all you saw, then you would still want to do it. But if it's something that you haven't really seen, and definitely you'll get to decide like, okay, this is not what I want to do. So yes, my plans did change.
I think oh, go for it, Brooke.
Oh, sorry.
Oh,
I
you're
was
fine.
just going to say, going off of what Leah said, also not only in the classroom, you also get to go experience the hospital a little bit as well. So in our veterinary skills and competencies, we have during second year, there's shadowing, and third year, there's treatment crew. So you get to experience different areas of the hospital, different cases, things like that. So I know for me specifically, when I've been in there, I'm able to see different things and I think, oh, that's pretty neat. I could see myself doing that. So sometimes just experiencing those different cases in the hospital and talking to different clinicians and other students, it helps you to decide also. So just those experiences helped me, I know.
I think also as a veterinary student, it's important that even if you have your end career goal, like I came into vet school knowing what I wanted to do, and I'm going to graduate knowing what I want to do, and it's the same thing. But I think as a veterinarian, it's important to keep your eyes open for all of this. Like I'm a small animal guy, but that does not mean that my large animal skills and competency is not important, because at the end, your board exam is everything. And also people are still going to talk to you about everything. So I think as a veterinarian, it's important to not limit yourself, know your interests and pursue them. Don't cut that off. But I think it is important to remember that you cover all of them.
Great point, Lauren.
There was also another question talking about relationships with professors. So personally, I think all the professors that we've had have been really pretty great, honestly. They're, with being such small classes, they're pretty easy to contact. I mean, some professors are obviously busier than others because sometimes they're in clinics and they're working, but a lot of times they get back with you as quickly as possible and you can meet with them pretty easily. So I don't know what Leah and Cameron's experiences have been, but for me, every time I email a professor and I need to speak with them about, say, a test, they're pretty great about meeting with you and just going over things. So
Yeah, I would say overall, I've had a great experience with the professors. I look back and see tons of positive interaction that I've had, tons of connections. I feel like I learned pretty well from most of the professors. I mean, no matter where you go, you're going to have someone that you learn different than how they teach, or they have a personality that maybe just doesn't click with yours. And so I think you have to look at it as a whole. I think overall, yes, I can work with them. I've had a great experience. I wouldn't take any of that back. So overall, yes, I would say positive relationships, and certain ones that I feel like are very good that I can email questions, little questions, and they're right there.
I definitely agree. I came from a smaller campus in undergrad, and I liked having that availability to my professors because they weren't managing so many students. So I definitely was looking for that in a vet school. So I like that if I have questions or I can meet, depending on how busy they are, they usually can meet and they will find the time. So I definitely like that availability with professors. And definitely the professors are one of the reasons why I chose Purdue. So they have great personalities.
I would say even during the pandemic, we've been meeting in person with students most of the time. Most faculty do.
And even with things outside of schoolwork, you can meet with a lot of different professors or faculty members. I know I have a couple times just to talk about random things, not even school. So that's one thing that's really important to me as well. So
I'll say something about that. Yeah, today I was doing what we call safe zone training, and it's given through Purdue University, and it's for the LGBTQ, community. And what was really great about it was how many of our faculty and staff were involved in that training, because they want to make sure they're there for everybody. They want to make sure that they have the skills and the knowledge, and to be able to make sure they're welcoming everyone, and to let everyone know that it's safe, no matter what, they're safe here. So it was really encouraging for me to see so many of our faculty and staff involved in that. And it's for our students, because it's so important to us. So.
And there's been like a lot of professors in our classes that I was even shocked by, where a lot of them will be like, even if you want to message me just to talk, or if you want to come by my office just to talk, they always have that like openness. And there's a lot of them. And some of them I have just gone and talked about life or how things are going in my life. And I talk about their family and my family. So we have had quite a few that are just interested in getting to know you and kind of seeing how you are and being that support system for you. So I definitely like that. There were a lot of professors who did that.
And there was some, as when we came in as first years before coming to campus and starting, we did an online module it was called Diversity and Inclusion. And it was literally just modules talking about acceptance and handling situations, and basically understanding that other people are people, and understanding that other people's perspectives. And I think that it was just something that, starting off on that note with everyone, was a great place to start. And so being that was implemented, I felt like that was just a statement that, yes, we are here. Like Lori was saying, we're here for everyone.
Yeah. And what's good at, not only do the students do those modules, but that's open to the faculty and staff, and a number of our faculty and staff have already done that. So I just overall feel like we're awesome in a nutshell. Thanks, Paul, for joining us. Enjoy your other meeting. And we are about out of time. And if I don't want to cut away, if anyone has any other questions, you can pop on and ask them real quick. And if not, I'll just give it a few more minutes. And if not, we'll say our good nights. But
yeah, if anyone has any questions, though, don't feel bad. I mean, we don't really have much going on right now. So
Students, yeah.
So if you three are okay with it, would you be okay with them getting your emails or whatever if they have?
Oh yeah, for sure. Send out my email. I love to brag on Purdue.
Oh.
So there's a question about tracks or classes for wildlife. That's something we don't have. We don't have a wildlife track, but we do have a program that we call off-campus blocks for students that have wildlife, zoo animal interests, and they can apply to get multiple experiences off campus during their 4th year at zoos or wildlife centers. And quite a few students do that. They have to go through the curriculum committee and apply to take these experiences. Students in large animal do that as well for things like palpation experiences, where we do it, but you don't get as much hands-on experience as you would in a busy dairy practice. I don't know, Brooke, do you want to mention anything about that?
Well, I'm doing an off-campus block next October for palpation. So does anybody have any specific questions about that? The application process or anything? It's just a few quick questions to answer, basically how you think that you can get, I don't want to say a better education, but it's not necessarily all offered in your 4th year curriculum. Like I couldn't go to a bunch of dairies and palpate 5,000 cows in a couple weeks like I could out in California. So it's basically questions like that, saying how it could benefit your education. But Any other specific questions about it?
I think Leah mentioned one of her friends took, that's on exotic pets, like pocket pets, birds, reptiles. It's an overview course, and that's a semester 6 course. That's one of the electives that students can take. And so that in terms of on campus, that's really the main exotics. We also have an avian course that is offered by our poultry pathologist.
Cameron's dog is gonna hit it. How many off-campus blocks can you do in the 4th year, Dr. Salisbury?
It depends on your track, but there's a limit of 60 per 4th year class. And so small animal students generally don't need to do any unless they have an interest in something we don't offer. For example, maybe dentistry or something where we don't have we offer dentistry, we don't have a specific block on it. So mostly it's students with non-traditional animal emphasis like zoo, wildlife, or food animal, where you want to get more intensive food animal experiences. Some on alternative therapy type, like acupuncture, chiropractics, those types of things. And so how many you can take, it depends on which track you're in, because that determines how many elective rotations you have. And so most of the tracks have 3 or 4 elective rotations. And that you potentially could take up to that many off-campus blocks, but it's a competitive application process, and it depends on your career goals and how these rotations you've set up would satisfy those career goals and satisfy the requirements of the program. So potentially up to 4, but most people it's 1 or 2 or none, depending on your career interests.
All right, I won't keep you guys much longer. We'll hang out here just for a few minutes if anyone has any questions. But don't forget about tomorrow night. We're going to talk to the 2nd years. I know we did this backwards, but the availability is why we kind of did this with our students. So tomorrow night is our 2nd years who are going to be talking about what it's like for them. And then of course, next week, we're kind of doing all this over again, but we are adding the component of the 4th years who will come on Thursday. So I know you guys are just dying to make it to next week to talk to the 4th years and see what that's about. So thank you so much. This has been, we enjoy it. So I think it's because during COVID and everything, we talk to each other, but it's nice to see other people, right?
I want you to know as much as you can about us, so you can make the right decision for you.
Right, right. So thank you so much. And like I said, we'll stick around here for a few more minutes in case someone has a question they want answered.
And if you do think of something later or don't want to say it now or whatever, please shoot us an email. We are more than willing to talk with you guys. That's why we're here.
Thanks, guys.
Thanks, everybody.
Okay, I actually have a question.
Yeah.
Okay. So my name is Madeline Coopers. I go by Mad, but my question was, when it comes to like diversity and inclusion training with those modules, is that something that you're doing like on a yearly basis, or is it just like a one-time thing? Because at my undergrad education, we did diversity modules at the beginning of each school year, and I didn't know like how often you guys go through training for that.
Well,
Yeah,
required in first year. During the first year, they have to do them, but then we have sessions during current issues in veterinary medicine to talk about different diversity topics. And we also sometimes have sessions in VSAC about some diversity topics too. You guys want to mention your experiences?
As far as the modules, we start out, like we said, at the beginning of first year and did them. And then those supplemental sessions throughout are usually led by Dr. Craig, who's in charge of our diversity program here at Purdue. And they're awesome. She's awesome. So we stay involved with it, but it's not like you have to continually go through the modules again.
Exactly.
Certificate program that the modules are part of. And so there's other activities you do in addition to the modules to get a certificate in diversity and inclusion.
And then my question was about the summer research experience that you had mentioned. So besides that, what do most first, second, and even third year students do during the summers? Like how does that?
Yeah. So what I did was I had a great relationship with the clinic back home. So I would go home over the summer and work there and just kind of get veterinary assistant, working as a vet student kind of thing, make some money, get involved with the cases. I know some people went to like far places and did things. I mean, there's opportunities for externships and stuff like that. I mean, after first year, I mean, you're kind of limited on what you can do just because you're not quite to like diagnosing medicine and stuff like that. But definitely, I'd say most of us stayed involved with veterinary stuff, whatever it may be, over the summers.
Study abroad.
Hmm.
So when you went back to the clinic that you had worked with, were you working as a tech, like doing blood draws, catheters, that sort of stuff, or were you more like an assistant? What was your role in the clinic?
I would say it was kind of a hybrid between it. I mean, I worked with great doctors, so they knew what I was wanting, that I was in veterinary medicine, and so they would talk to me about cases and kind of like introduce me to topics like that. But then also, I mean, with VSAC, you are starting to do clinical skills at school, so I was able to go home and be like, I'm going to place some catheters, some IV catheters, or I'm going to go home and like help with dentals or stuff like that, where I can kind of, I would try to find opportunities that would push me a little bit to utilize those things that I had learned, because I feel like after first year, you learn medical terminology and you learn how to place a catheter. And so those are two big things that you can go home and show. And so I feel like that was kind of what it was based around.
Thank you.
Of course.
And some people just don't do anything. They're just like, I'm not doing a thing. Or they work.
Yeah, I did kind of half and half. Like half of the summer, I kind of did what I wanted to do. And then the other half, or maybe this previous summer, I went to the clinic, but I didn't like want to necessarily get hired because then I would have to be there for like all day. So I kind of did it on my own time. So I was able to like get the information I wanted to, but also enjoy like the last summer I'll ever have to enjoy as a student, because, you know, after your third year, you kind of lose that summer that you normally have, and you go straight into clinics. So I kind of wanted to enjoy it. So by all means, you don't necessarily need to. I know our first year, Dr. Wiseman told us, like, if you go home and you don't do anything, Purdue gives you enough information that you will be fine. You don't have to constantly be studying all the time or feel like you'll get behind. I mean, of course, it's good to review those things and you should, but you don't have to stress about it. So you can go to the clinic, get your hands-on training if you want, but it's not necessary and you can always do it on your own time. But of course, if you want money, of course, you can go ahead and get the job.
I had a similar experience to what Cameron said. I did kind of a little bit of both as far as placing IV catheters and assisting. With the assisting aspect, you kind of get to practice your history taking skills, which is an aspect that not everybody likes to think about, but it is pretty important. So that is one big thing that I don't say I tried to focus on, but that you don't think about, but you actually get experience over the summer if you are assisting. But I don't know if everybody heard Dr. Salisbury mention, but a lot of people do study abroads over the summer. People from our class a couple years ago went somewhere in Africa. I can't remember where it was. Yeah, and it looked like they had a lot of great experiences, but I personally haven't done any travel abroads over the summer, but I know that there's also a couple of the companies that works with vet schools. So Zoetis sponsors an externship over the summer. I think they do one for bovine and one for equine. So that's another opportunity, and they have scholarships to go along with those. So, and then like Cameron mentioned, the summer research. So Purdue provides quite a few summer opportunities. Also, we have some resources on I believe it's on DVM Connect website. So,
and sometimes the hospital, at least the large and small animal like ICU stuff at the vet school, sometimes they're hiring student help. And so last summer I did the summer research program but it was mostly online because of COVID. And then I did night rounds in the ICU because I just wanted to be around patients. So there's a lot of opportunities, and there's not one that's right and one that's wrong. It's you just kind of cater to yourself.
I'd also say, depending on like if you do go to a practice to kind of like get some more hands-on in those summers, if you're kind of the person where maybe you had a little of experience, but you haven't had years of experience, I know for me, it helped having a veterinarian that kind of pushed me out of my comfort zone. So having that, because I mean, once you get into third year and you're doing surgeries, you kind of are always out of your comfort zone. And especially when you go into clinics and you're now the doctor, having a veterinarian those summers maybe push you to kind of think more like, okay, what are you going to do, rather than, oh, what do you want me to do? So someone that, you know, you can be an assistant for, but they still kind of want your buy-in on what you're thinking and kind of push you to think about what you would do, rather than always asking what they would do. So that definitely helped, because I know there are a couple of times where my vet would be like, okay, this is your patient. You tell me what you want to do, or what do you see? Tell me what you see in your physical exam, stuff like that. So that definitely would help as well if you're someone who needs to kind of get out of that comfort zone.
Sorry for the long answer.
It's exactly what I was looking for, so thank you.
Okay, good. We like to talk.
Alexandra, you have a bunny there?
Yes.
Oh!
This is Marshmallow. I'm an undergrad here already, so she's a fan favorite in community practice.
Okay, cute.
Yeah. She likes to cuddle with me, so I figured she would enjoy the meeting too. I actually had a question though. I'm obviously an exotics person, so I'm wondering like what classes like are offered for non-traditional animals, other than just what you can do in externships. Are there like actual courses, like elective courses?
The one that I mentioned was the non-traditional pet sport. And so they go through birds, reptiles, pocket pets, and various husbandry and diseases of them. It's a 2-credit elective course in semester 6.
Also, like one more little question: is there any opportunities for like lab animal medicine course-wise, or would that be?
There's a lab animal medicine elective course as well, and actually there's 2 of them now. There's we've had a lab animal medicine 1-credit lecture course for quite a while, and one of the lab animal veterinarians at Purdue has now expanded that to offer a 2nd elective. So there's going to be 2 elective courses in lab animal medicine, each 1 credit, that will be offered over the next couple of years. And there's also a rotation in lab animal medicine, a 3-week block in the 4th year.
Thank you.
I said, thanks for showing us Marshmallow. That's his name, right? Is it her or him?
It's a her.
2 years ago, we had a student who had a bunny too. I can't remember her name. I think the bunny's name was either Oscar or something, and it was actually she took it to libraries and it read, so students.
Oh, that's cute.
Because it helped, it helped the students, the kids, be able to have something to read to and help get over their anxiety of reading out loud. And so from then on, I'm like, that's the cutest thing I've ever seen. So it's neat. So, all right. If we don't have any other questions, let's call it a night, and we will see you tomorrow, okay?
Everybody.
Thank you.
Everyone.
Thank you.